what I'm really feeling for here is the congestion. So how much of the skin is free. The least amount of skin that's free tells me that basically the flow of all the liquids, fluids, blood, water, interstitial, everything is congested, and the fact that things can move freely inside of all of these sheaths is probably constricted as well. So I'm looking for things like this. Like this I don't want to see down here because all of that tissue is bound and I can't get that tissue to go like this, which it should do, and it's not doing it there. So I want to know that stuff. I'm not going to work up here, but I want to know that stuff. So I just palpate to find out which muscles are engaged and closed. So brachioradialis very tight. You can see that also by this angle here. You see the humerus comes down, and then the radius ulna jut over a little bit, so the arm is not in a straight line. It should be in a straight line. So that says brachioradialis is very tight, or this anterior lateral compartment is very tight, thus pulling all of this way. Does that make sense? So if you think about it as a mechanical advantage, the body's just finding that mechanical advantage. So this is weak. This is very chronically tight. So what I would normally do is work this whole area, and in one of my clients, actually, over the course of about 8 months to a year, we've got this to almost go away, which is absolutely phenomenal. Surprised me one day. I looked at it and I was like, dude, do you see that? Oh my God! The other one was worse, and it was awesome. So then I want to find out. This is really the meat and the potatoes of all this stuff. This, from the tightness here, all the way lateral over top of radius and ulna, going into the carpals, and then right in the middle. That's where we want to work. So how I'm going to start, depending on their discomfort level, and I know she has a very high tolerance for discomfort to a certain point, right? We're going to work with that, and we're going to do a lot of compression and rolling. Maybe a little skin rolling, but I doubt it. Compression and rolling, and I'll show you how the rolling is going to happen. It's going to happen probably different than you're thinking. So the compression will start by taking these lines. I divide it here. So the radius is directly underneath here. I want to take all this tissue and actually push it on one side of the radius and then push it down between the radius. Does that make sense? So I have this radius here. I'm pushing the tissue that's on top of it over it on the other side to elongate that tissue and to break it up. Does that make sense? So I'm using the radius or the ulna, respectively, as a tool to help me get shear on the tissue, to open it up. Then I might do the same thing on the other side, and then I want to open this middle compartment up, because that's where everything's coming through. Is this middle compartment is the carpal compartment. So I want to open all of this up. Let's check the flexibility first. So she can do it, but we really got to work to get that. And then that's there too, but very tight on the lateral side here, and we have to work pretty hard to get that. That's an alright stretch, but very tight at LI4. Oh. So, put her elbow in a good position, so I'll externally rotate this a little bit longer than I want, but she's already got that angle. We talked about that biased angle, so we're going to deal with that. So what I'll do is take my thumb here on the line that I want, which is slightly over top the radius, but I'm also going to be able to push down underneath it. Then I'm going to take my other palm and lay it on top, and I'm literally just going to slowly compress down. This is literally about 60% of the work. So I'll hold minute, 45 seconds, a minute, a little bit of rocking to get underneath the tissue a little bit, and I'll try to feel by going on the tip a little bit more what that feels like, tipping my thumb, and then coming back on my thenar eminence, kind of feeling how that tissue's working. Then I'll move slightly down. In the middle here, from here to here, is where the most stuff is usually congested and where you're going to get the most discomfort. So the more you move in the middle of that belly, you've got to be careful, because it can really wake some people up. So we're just working medial of the radius right now. Then I might do some deep compression pulses. Okay. Then I'm going to go to the ulna. Depending on what fingers are numb, I'll start at different places. But both in her are tight. There's a much easier way. I'm going to show you in a second to do this. This is actually more work, harder way. Okay. First step done. Now, okay, ready for movement?
Mm-hmm.
Okay. So, from here to about here is really stuck. So what we're going to do is we're going to use kinetic movement. This is the beauty. I love this stuff. We're going to take the natural range of motion that the arm is given, which is what? What do we got? Flexion, extension. Not a lot of other stuff. I mean, it rotates, but really it's about flexion, extension, right? A carpal tunnel, you would say you're deficient in what and proficient in what?
Extension, you're deficient.
Extension, you're deficient. So this is bound up, this is difficult. So what we're going to do is we're going to shorten, loose fist, flex wrist, shorten flexors, create compression deep in the compartment, and then have them actively open into extension. And when they do that, I create this tacking, and they unglue their own tissue. Two things happen at this point. One, miracles. Two, they are now active in it, and it is not going to be comfortable. They are active. They are doing it. I am not doing it to them. They participate in their own uncomfortable healing. It's gorgeous. Most, not all. Okay, loose fist, flex wrist. I'm just going to leave that down. Great. Once it's flexed and loose, then I go in. Okay, and then slowly extend wrist, then fingers. Yep, and there'll be a sticky point. I want you to push right through that. And then big wide fingers, open, open, big wide fingers, big wide, 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 wide. Good, now push into the table with your hand. Really extend that. Yep, there you go. Okay, good. And relax. Okay, loose fist, flex wrist.